Okay. Okay, right, that's the chimes dealt with. Okay, I'll kick off with the usual introductory business. Welcome everybody. I'm Councillor Jason Fazackley, Cabinet Member for Health, Wellbeing and Social Care. Please be assured that we've put appropriate cleansing and social distancing measures in place to ensure this meeting is undertaken in a COVID-secure manner. This has included a request for all attendees to have taken an LFD test within 48 hours of the meeting, the use of the track and trace and app or attendee log, 2 metre social distancing, the wearing of masks when not seated, and a one-way system into the Guildhall. Limited public seating has been made available, however this meeting is also being webcast to allow the public to attend remotely if they so wish. Please be advised that the public seating area is not in view of the camera used to webcast the meeting. Can I please ask members to remain seated at 2 metres throughout the duration of the meeting and to wear a mask unless seated. Deputations, we don't have any deputations, but can I just say a brief hello to former Lord Mayor and Councillor Dr Alan Burnett. I noticed up in the gallery. Good morning to you, Alan. Housekeeping, if the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble at the turning circle at the end of King Henry Street, past the University's Park building. And in order to comply with the Guildhall Trust fire marshal regulations, anyone who has signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact this meeting will be live streamed. Everyone speaking via a microphone will be on camera, including those making deputations, which we don't have any, and members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly they do not wish to be recorded. Please can everyone use the microphones and remember to switch them off when they've finished. Right, as I've mentioned, we've no deputation requests. First item on the agenda is apologies. We've received one apology, which is from Councillor Jeanette Smith, which I believe is due to work commitments. No other apologies that I'm aware of. Item 2 is declarations of interest. Does anybody have any interest to declare? Nope, nice and easy then. Item 3, first formal paper, which is the Independence and Wellbeing Community Services and Co-Production Report, which you can find on pages 7 to 14 of your agenda. Can I hand over to Mark? Is Mark here? Was it you doing it, Andy? You're doing it, okay. Right, over to you, Andrew.
Thank you, Chair. Good morning, all. The paper's before you, so I've got a short summary of that and then happy to take any questions as appropriate. So the purpose of the paper is to update yourself, Councillor, as the portfolio holder and spokespeople of the programme of work and aspirations for achieving co-production of services with those Portsmouth citizens with care and support needs and any other stakeholders involved. The paper sets co-production in the context of the adult social care strategy and highlights the importance of working with individuals, communities, support providers and other services. The paper demonstrates the ambition for empowering practice. It also touches on one of the drivers for adult social care, which is our independence and wellbeing team, and how that team works and its priorities, and how we intend to work with our care providers in 2022. We've provided some practical examples to illustrate these approaches. When we talk about co-production and use terms that people might not be familiar with, it can be a bit opaque, so trying to put some practical examples in there to illustrate what we're talking about. The paper also provides more detail around defining co-production and demonstrates this as a shared ambition with stakeholders in the city. I think, as you probably come to expect, adult social care doesn't function alone in the city. It works very closely with its NHS partners and with various other partners, with the university, with the constabulary, to try and think about a whole city approach rather than necessarily a siloed approach in whatever we do. And given that this is such an important topic, being able to enable our citizens to have a say in, to design, to drive the services that we provide, that's also a shared ambition with our other partners. So that's a brief summary of the paper, but happy to take any questions that anyone's got.
Thank you, Andy. It's relatively straightforward, but do I have any comments or questions from anyone? Kirsty?
Thank you. So I welcome the principle of co-production in adult social care, and I've got no doubt it's the way forward. I've heard really good things about co-production, and I've also heard concerns as well. So the concerns have been around previous consultation initiatives and it being like a lip service and not maintained. So I was just wondering how we as a local authority will approach this differently, and how will that be monitored and reported? Thank you.
Thank you. Yeah, I think so. I think consultations, we often see the word consultation used when there isn't a lot of choice because the result is predetermined. That's how it's felt anyway. So I think we try and avoid consultations. The lowest level is engagement, is going out and speaking to people, explaining what we're doing and trying to get their feedback as to how we do it. But there's in the report, there's something called the ladder of co-production, and it takes us through the various levels we're at. So in some cases we are giving people information and advice because we're providing a statutory service and there's only one way of doing that. But what we want to do more and more is to move away from that. So for example, we had, and I think this is mentioned in the paper, we had the care part of our extra care service across the city came up for tender in the middle of last year. And what we did when we were looking at selecting the company that would provide that care for people, so they've got their own front door but they've got care on site, was involve residents and families in that tender. So here's what we're doing, here's why we're doing it, you're a part of this, it's your service, so you get part of the casting vote on who the individual is, or the company that provides that. That links quite clearly with the emphasis on social value in contracting that the council has said is one of its priorities in the past year or so, and intends to make the interaction with our citizens genuine rather than lip service, rather than tokenism. We'll be monitoring it through a governance procedure that we've got internally. So our senior management team focuses on various areas of the service on a regular basis, on a monthly basis, and one of those is governance, to understand that we're doing what we said we were going to do and to measure ourselves against how we've done that. So regular reports coming into that. We'd intend to bring any updates, reports, progress back to this forum, back to the portfolio meeting for information. And so we're not just marking our own homework, we're also asking you as members to assure that we're doing what we said we will. No problem.
Lewis? Sorry.
Thank you. It was just to say thank you really for the report. It's useful to see the pathway that we're looking to go more and more down. It's useful to know that we're looking at a whole city approach on things, because that is the only way to give people the independence, and we might not be the best people to deliver certain services, and it's good that we recognise that as well as the benefits we can bring. So thank you very much.
Yeah, thank you to both of you, and thank you, Andy, for bringing for presenting the paper to us. I think it's important to bring this report's only for noting. I think it's important to bring it into the public domain so people, rather than ourselves in-house, can be aware of it. Obviously, ourselves as councillors, including my colleagues, opposition spokespersons, we've always got the opportunity to raise this at any of our monthly meetings, or indeed at any other time throughout the course of the working year. But hence the reason bringing it here, so it's actually on record, so people can see it. So thank you very much indeed, Andy. There being no further questions or points on that one, can we move on to item 4, which is in regard to PPM1s, which again I'm suspecting is yourself, Andy.
Thank you, Chair. So the purpose of the paper is to update portfolio holder and spokespeople of the approach that the safeguarding team in adult social care is taking in regard to managing police notifications. And what the paper does is gives a brief description of those notifications, what they're about, and the context to the increase in demand on our safeguarding function since the advent of the COVID-19 pandemic. Initially, during the first wave, so going back to sort of March, April 2020, we saw a decrease in safeguarding referrals for input, but that wasn't reflected coming into the second wave and since that point. So we've seen quite a significant increase in demand where people are seen as adults being at risk and in need of support. The paper sets out the experience of the referrals in the past in terms of how relevant they are, whether people gain consent, police officers gain consent before they send them, and what we then do with them, whether we find they do need a safeguarding response. And because of the limited number of those referrals that are actually relevant to adult social care, it then sets out a plan to manage the backlog of referrals by doing a sample and then a short-term plan to manage those going forward. I think the important thing for me when I was rereading and reflecting on this morning is that where we have high-risk notifications, those are brought to our attention by our police sergeant colleagues. They don't just sit in that sort of pile. I think it's also probably important to state that whilst we find that most of these PPN ones aren't relevant for adult social care intervention, they are reflecting that the officer on the scene is worried about the situation. So we're not saying that they're being done needlessly, we're just saying that it's not particularly for our service. I think the other thing that's probably important to reflect is that we're part of an ongoing Pan-Hampshire group along with our other colleague local authorities in Hampshire, Southampton, Isle of Wight and Hampshire County, in working with our police colleagues to try and manage a more appropriate referral route, but also acknowledge the concerns of the officers that prompt some of these inappropriate referrals. And that's a summary of the paper. Again, happy to take any questions anyone's got.
Thank you very much. Colleagues, any questions?
It's not a question, it's just a comment. So I think it's important that we support, and strengthen the adult social care MASH team to catch up with the PPM ones without placing extra pressure on the limited staff and capacity that you've already got. So thank you.
No, I mean, that's a phenomenal figure, really. 97% not making the criteria. 700 is a heck of a lot to go through. I mean, I don't know, it might be an issue to speak to Donna Jones about with regards to the police, about the way these are coming through, because clearly what the police are being instructed to do isn't tallying really what we've got. So I understand perfectly the reason why we're doing this. I'm slightly concerned because, how many times over the years have we heard something that's missed, and it only takes one or two cases to be missed. But in the way this is described, then, okay, I think that's the most sensible way forward, and I hope this doesn't come back to haunt us. Thank you. Oops, sorry. Silly of me to ask, really, but I think it's you next again, Andy, in regards to item 5, which is a useful but slightly depressing paper about the risks and challenges facing adult social care during the current year and the year ahead. Andy, across to you.
Thank you. The paper before you it doesn't really come up with a lot of solutions, unfortunately, because I think many of the solutions aren't necessarily within the gift of the council. But it's a paper that was asked for following some discussion at the Employment Committee where the council was considering whether the national living wage should be paid rather than, not national living wage, the foundation living wage rather than national living wage to its contractors. And adult social care being the largest spend in the council and having probably the most contractors paid on national living wage contributed to that committee report. So the paper sets out the national context for adult social care, and there will be differences between national context and local context. Most of the national context is an aggregate of other local authorities, but there will also be similar struggles, I think, up and down the country. It talks about increased need and demand. It talks about the impact of savings and delivering balanced budgets. We know the impact on local authorities from 2010 to 2020 in terms of the funding that they haven't had and that we've all had to cut cloth to return a balanced budget. It talks about the challenges in recruitment and retention. That was an issue beforehand, I think, before the pandemic, but it's been particularly acute post-furlough, the end of furlough, and the hospitality and other sectors offering greater wages, bonuses, that kind of thing has really impacted on social care recruitment. And there's also, of course, been an impact, we mustn't forget, on unpaid carers, where care is unable to be provided, or where we were in lockdown, often there is a real impact on people who are caring for members of their family or friends who aren't formally being paid or recognised for that. So the local context for these challenges for Portsmouth is detailed in the paper and illustrated with messages from local providers of domiciliary care to try and give us some local context. We have very regular interaction with our providers in care homes and in domiciliary care, in extra care, in supported living. And because we are a compact city, we're fortunate in understanding, having a very clear picture of what's happening on the ground and what they're telling us. And then tried to highlight the risks that those challenges pose to delivering care and support to all those people that need it. Finally, the paper highlights the potential impact of national policy changes and an analysis of the relevant national sector organisations on the ability of those policies to mitigate these risks. The paper was drafted in November, and so it's just worth covering a couple of points off of developments since that time. So the national living wage that's quoted in the paper is at the current 21-22 rates. That will of course change, and we've seen those figures come through. But whilst it will change, the highlight headline wage will move to £9.50. We're not entirely convinced that that's going to have a major impact, given the wages that are being paid in other sectors are quite above that anyway. At the time of drafting, we'd seen 3 agencies give us handbacks of care, but by the time we got to the end of November, that was 9. Now we relocated care for those people, but it was difficult to do so because we've got a real issue in locating domiciliary care at the moment. And it's just worth updating that as a City Council, we've agreed to use one of the government grants, the Workforce Recruitment and Retention Grant, to fund a domiciliary care rate rise prior to the 1st of April next year. So from the 1st of January this year, from the 1st of January this year to the 31st of March this year, we brought forward an extra rate rise, and we're at the moment considering our rate rise from the 1st of April onwards. So I just thought it was worth updating. We've used some of that government grant money to improve the pay for domiciliary carers in Portsmouth. That's a summary of the paper. It isn't particularly cheerful. We are working with our colleagues nationally, and we are trying to have some purchase on national policy through organisations such as ADAS, National Care Forum, with the Department of Health and Social Care. But there's some challenges we're having real difficulty mitigating, I think it's fair to say. Happy to take any questions.
Thank you very much. Any questions or comments, anybody? Lewis.
Thanks, Annie, and the update is quite useful. With regards to the uplift that we're putting in place currently, and obviously I know it's just started, we're only just in January, what's the feedback on that bin? Just because one of the concerns that was raised at Employment Committee around this report was providers had some concern with different rates for us and other local authorities, and whether that would actually help with attracting staff or actually hinder their practices. I just wonder if there's been any feedback on that.
Yes, we've seen some. At the moment, it's mainly positive, because I think that the domiciliary care agencies generally, not exclusively, but in the main part, work within a geographical boundary. So most of our folk that we work with as dom care providers work within Portsmouth. So that the issue about 2 rates, potentially from another local authority such as Hampshire, hasn't really come into it. So mainly we've had positive feedback. We've also had some, I won't call it negative feedback, because I think it's balanced and it's reasonable. We also had some feedback saying, well, you've done that, but it's still not enough, which I would absolutely acknowledge. We still aren't at the rate that some other sectors are offering people, but in the main it's been positive.
Kirsty?
It's going to be no surprise that I've got a fair bit to say about the living wage. So thank you for that, Andy. And overall, all the report focuses on a negative situation. I think we need to look at the positives as well of increasing the living wage. And while I don't wish to advocate for further pressure on adult social care funding, I think we do need to weigh up the positives of increasing a living wage. And if you increase the incentive to be a carer, and more carers are employed as a result of a decent wage, you will end up saving money in the long run by not having to pay for care home costs and agency costs. You'd also be saving money while achieving better quality care and with less staff leaving as well for better jobs in supermarkets that pay better wages. So I think the report also assumes as well that the council will have to take full responsibility for any wage increase. And I know many care providers are struggling, but there are also providers as well that make quite a bit of profit, and they have CEOs on mega amounts of money. Perhaps they could take some responsibility for increasing the wages. That is a bit provocative, but there we go. And yes, so I think also, I have said it before, and I'll say it again, councils can't play their part in delivering adult social care when the problem lies centrally with the government and funding from there. So yeah, it's a heartbreaking situation. It's a very difficult situation, but thank you for everything that you're doing.
Thank you. I think it's also worth updating, because you're right, there are positives to every situation. It's also worth updating, and I hadn't written that down, that we're currently engaged in a local recruitment campaign, and that's had some success, more so than the national one. And also doing what we can to think about a care pathway, a care career pathway. That's very difficult without that national funding because we've got very limited funds, but we are, where we can locally, trying to have an impact on that. So it's just worth noting that positive too.
Thanks, Kirsty. Some really relevant points there. And certainly I know from administration's perspective, trying to get the national minimum wage, a living wage, is something that we've looked at, and we are definitely trying to pursue. The stark reality is, as you can see, there's some pretty huge figures in there, 7.7 billion over 10 years withdrawn from adult social services across the country. The report also shows, just in Portsmouth alone over the last 3 years, 10.7 million extra required to be pumped into it because of rising costs. It is difficult. It's hard sometimes to look at the positives that are coming out from this paper. I think one thing I would say that I'm grateful to my opposition spokesperson colleagues is for the fact that we've been really level-headed over the last, well, since May, when we've all taken, apart from Jeanette who was here before, that we've taken up active role within this particular portfolio, and I think we've all worked reasonably well in regards to cooperating and trying to do the best for adult social care, but it's a difficult slog, and that's not going to leave us for some time to come yet. So I just echo what's been said, Andy, unexpectedly, thanks for the paper. Whilst it doesn't make good reading, at least it's an update and gives people the opportunity to see what the reality is, and we can only hope through representation and what we can do individually that we can perhaps try and readdress what's a clearly difficult situation. But thank you on that one. There are no more comments or questions in regards to that particular report. That moves us on to our final one, which is COVID-19 intelligence update, which we're all fairly familiar with, but this is Matt the Stats' latest feeding to us. Up and running, Matt, off you go.
Thank you, Chair. So as the report states, the data is all updated on the Council website every Friday, so most of this is publicly available and will be updated again tomorrow, but I'll run through the latest position that we're in at the moment, with the caveat that there's an awful lot of uncertainty at the moment around what the data is showing. So there's a lot of noise in the data through a combination of factors. Very different behaviours over Christmas period in terms of how people are testing, reporting of tests, changes in government policy, both announced and implemented, availability of tests, processing of tests, all of which are played out in different ways in the data. So there's quite a lot of noise in that data, and we do our best to interpret it. On the screen at the moment is a summary page from the National COVID-19 dashboard, so that's updated at 4 o'clock most evenings. And along the bottom, from the left-hand side, is total positive cases, so you can see on there that we have seen a reduction in reported cases nationally over the last 7 days. It's down about 20% on where it was a week ago. And then moving along, deaths continuing to increase. They're relatively low numbers still in the context of the pandemic as a whole, but they are up nearly 50% on where they were a week ago. Hospital admissions have been increasing, but again, you can just see on the right-hand side of that third chart, just starting to potentially level off in terms of new COVID-related hospital admissions. And total tests undertaken, again, reasonably stable, but bear in mind that there's a significant programme of asymptomatic testing of all secondary school pupils that happens across the whole country in the immediate prior to return to school week, so that will increase the testing. So there's probably been a decrease in tests amongst the adult population, masked by an increase in tests in the school-age population. And then at the top there, vaccine stats, so 90% of the population have 1 dose, and are up to just over 62% of the population that have had their booster or third dose. Again, bearing in mind that that is the all over 12s population, not all of whom will be eligible for their second dose even, let alone booster doses. So that's the national picture. In terms of locally, similar really, we have had an awful lot of cases, so this has played out significantly in terms of business continuity issues in services like Andy's, but all over the council and healthcare and other parts of the system, schools, etc. 3,000 plus cases in the last 7 days, and it's been like that for a few weeks now, but it does look like the numbers have just started to come down, having peaked at well over double the January wave from last year in terms of daily numbers of cases. And again, just to add to the complexity with the data, this nationally reported data doesn't include reinfections, and we know the proportion of cases that are reinfections with the Omicron variant are increasing, so the real numbers are probably a bit higher still than that. But that's where we are, and that's what it looks like across the rest of Hampshire and Isle of Wight. It's a very similar picture, all 4 authorities peaking somewhat suspiciously at exactly the same point in terms of how pandemics would normally grow, which generally means there's been a policy change. So you see that when there's lockdowns, but I think that peak coincides so closely with the Prime Minister's announcement about the changes to requirements for confirmatory PCR that I think that's part of what's driving it. However, we also think from the modelling work that we are around about where we'd expect the peak in new cases to be sometime in the next week or so. So it's not that it's not that we haven't genuinely seen a peak, but we might not have quite seen it yet. It's somewhere in between. But that's the best available information we have at the moment. Portsmouth's 7-day rate at the moment is at just over 1,500 per 100,000, so more or less where it was a week ago. Above the South East average, but below the England rate, and slightly higher than our neighbours. Isle of Wight, the lowest of the authorities locally, and one of the lowest nationally. And then we've seen fluctuating rates in different parts of the country, so it's been very much a different regional picture. So London was the first place to see really high rates. They're now decreasing in all London boroughs. We then saw issues in the northwest. Moseley, currently the highest of the kind of original group of northwest authorities that went up, again stable there compared to a week ago, and then the northeast went up last week quite significantly, but again has started to slow in terms of that growth. So Middlesbrough is currently the highest rate in the country. So it is a very mixed picture across the country as a whole. In terms of our local rates broken down by age group, so again, if you look at the right-hand side of that chart, you can just see that we've now seen in the last few days decreases in the rates in all ages, with the exception of the 0 to 14s. So with those school ages returning, we'd expect to see school age cases continuing to increase, probably with a bit more mixing over the next few weeks. But we have seen decreases in all other ages, including the over 60s, which is obviously the more concerning in terms of vulnerability. So it is looking reasonably positive. School age we break down in a bit more detail. So the yellow line is secondary ages and the blue line is primary. And what's interesting is that both of those rates started going up at the end of December, so well before any return to school or any preschool return testing. We were seeing increases, so probably a mixture of household contacts with other members of the family over the Christmas period, leading to increases there. Vaccine uptake, so in Portsmouth we're at 79% of people have had a first dose and 52.4% that have had their booster or third dose of those aged 12 or over. using some different, more data, we can look at the percentage of the eligible population. So 77% of those people who are eligible to have had a booster dose, i.e. they had their second dose 91 days ago, had received a booster dose. So really good progress locally, and you can see the daily delivery of numbers there. We were hitting peaks of around 4,000 a day just before New Year of people receiving their booster dose. Dropped a bit since then, but we'll be picking that up again in January. So good progress on boosters. Hospitalizations data, so the chart on the bottom is the published data, which is always a bit of a lag, but you can see there just around 86 patients in Portsmouth hospitals with a COVID diagnosis. It's up over 100 at the moment, so it has increased a bit since that published data. And the inset chart shows our local data that goes up to yesterday, and you can see there that it's more of an increasing trend in hospitalisations, so growing pressure from COVID at the hospital trust. But still, if you compare it to the January wave last year, we're still well below that. But very different circumstances. We were in lockdown with most other services having stopped then. So lots of challenges there. I've included this chart from one of the national reports, again, just to show the impact of the reduced severity of the Omicron variant in terms of outcomes. So this is national rates of hospitalisations. The blue line is all hospitalisations, and the orange line is those being admitted into intensive care. So you can see we've seen that increase in people being admitted to hospital, but we're not seeing the same increase in people then needing to go into intensive care. And of those that are, the vast majority of them are unvaccinated. That also then plays out into positive results in terms of mortality. So one death within 28 days of a positive COVID test in the last 7 days. So again, this wave has not seen a spike in deaths, anything comparable to wave 1 or wave 2, which is obviously very positive. And we're seeing deaths each week in Portsmouth for the last few months, broadly similar to what we'd seen an average year in the 5 years pre-COVID. So that's also encouraging. So that's all deaths from all causes within Portsmouth. So it's not that we're seeing lots of deaths from other causes. We're generally seeing a reasonably normal picture, if you like, for the time of year. And I'll stop there. Happy to take questions on any of that.
Any questions? Any comments? Nope. Okay. Well, thank you, Matt, as always. That brings an end, basically, to today's meeting. No other items on the agenda. Just remains for me to thank Andy, Matt, and officers for their ongoing efforts and comprehensive reports. And to reiterate what I said earlier, in regards to my opposition spokespersons, thank you very much for your support and your active involvement throughout the course of the year so far. And with that, the meeting is now closed. Thank you very much.